Body camera footage from Milwaukee police shows what happened when they were called to Providence Milwaukie Hospital December 12th. Hospital staff told them a homeless man was discharged, but refused to leave.
He's been evaluated medically. There's no medical problems for him. This is a chronic problem.
Over the course of the video, officers evaluate what to do and decide to take Jean-Michael Descamps to Unity Center for Behavioral Health in Portland. At times, they question why the 26-year-old is being released from the hospital's care.
He can't be on his own. We can't. Huh? Why is he being released?
He's doing it electively. We had him set up with a shelter, a cab to take him to the shelter, and he didn't want to leave. He wanted to stay here all night, and so that's how that went for him.
It's not really a medical problem. It's malingering.
It's not really a police problem. Yeah, it's not a police problem either. No, it's not. It's a community problem.
When officers arrive at Unity, they find Descamps unresponsive in the back of the patrol car, calling in first responders as they start CPR. Within a half hour, Descamps is pronounced dead.
Time of death on this is going to be 11:31 p.m.
A week later, the Oregon Health Authority launched an investigation into Providence Milwaukie under the Emergency Medical Treatment and Labor Act. The federal law ensures public access to emergency services, regardless of a patient's ability to pay. OHA found Providence to be in what they call immediate jeopardy, saying their noncompliance with that law was putting patients at risk. OHA later dropped that status after they say Providence presented a plan to address the issues, but the state's investigation continues.
The fact that OHA found them to be in immediate jeopardy so quickly really points to how serious this case was.
Meantime, Disability Rights Oregon opened its own investigation into this very incident.
DRO released a report 5 years ago on this very subject, and it's just so incredibly frustrating that nothing's changed in those 5 years. We still have the same thing going on in these emergency rooms.
Dave Boyer, the managing attorney for DRO's Mental Health Rights Project, says after reviewing the video, he believes hospital staff did not adequately assess Descamps or provide appropriate treatment or transfer. He found one interaction in particular to be striking.
The body cam where the police said, "Why is he being released? He can't be on his own." And then the supervisor says, "We have no place to take him." I mean, that is really the core of the problem. This isn't a police problem. This is a hospital protocol problem. This is a Oregon mental health system problem.
Now, in terms of what happens next with the Disability Rights Oregon investigation, Boyer explains there could be a variety of outcomes, from a report released to the hospital or publicly to advocacy and changes to the law, or even filing a lawsuit. We'll continue to follow these investigations and bring you the latest on air and online. David.
Thank you, Alma. Appreciate that follow-up tonight.